As we age, our skeletal system begins to feel the effects of years of active living. Our bones and joints are typically the last thought on our mind until it becomes an issue. Here to talk about bone and joint health and ways to remain mobile throughout the years is orthopedic surgeon Dr. Dabezies with Sacred Heart Orthopedics. Thanks for being here.
Thank you.
Well, when we talk about bone and joint health, what are we really talking about, and why is this becoming such a talked about topic?
Well, I think when you're talking about bone and joint health, probably the number one thing that we can affect is osteoporosis.
Okay.
There's a lot of things that you can you're not able to when you're talking about osteoarthritis. A lot of times it's genetics or prior injury, but osteoporosis is something that we see it with increasing frequency, and it's usually painless until something happens where somebody breaks a bone. Once you get to that point, then you're dealing with deformity and pain from the fracture. So as an orthopedist, I see them with the fracture. We'd like to see it be treated before we get to that, but once I see it, my job is to fix the deformity, get the patient recovered, but also prevent the next fracture.
Mm-hmm. So what type of symptoms might someone see prior to getting, having a fracture and getting to you?
Usually there's no symptoms. You might see some of the people, the typical thing is the people who their height starts settling down and the little micro fractures and things like that. But the number one thing is a fall from a standing height should not fracture. So if you are somebody who has had a fall and from a standing height, just tripped and fell and broken a bone, that's a sign that you could have osteoporosis. And what you really need to do is be evaluated and treated to prevent the next fracture. We used to let the just treat the fracture and let the primary care doctor manage this, but we found that it really wasn't being done in a very comprehensive manner. So at Sacred Heart Hospital, we have a joint center and we take care of these people, and when we see them come into the hospital, everybody with a fragility fracture is what we call it when they break from a standing height. So if we see somebody with a fragility fracture, we do a pretty comprehensive workup that involves blood testing and an endocrinologist to evaluate and see what we can do to prevent that next fracture.
Are there any screenings available that might draw some attention to maybe someone needs to be more careful or talk with someone?
Well, sure. DEXA scan or a bone density test is done a lot for females that are postmenopausal. But if you get that fracture, then you probably should have a DEXA scan done a lot earlier and possibly at a young age. But probably the number one thing that we found when we've done the testing is that it's an extraordinary amount of people that are deficient in vitamin D. And vitamin D is important because it helps you get calcium in the stomach, draw it into the bloodstream. And if you don't have vitamin D, your body robs the calcium from the bones and you become osteoporotic. So as we've tested people, we have found that people that come in with fractures are probably 80 to 90% of the people that show up with a fracture are deficient in vitamin D. I tested my family. Every member of my family, 5 people were low in vitamin D, which is really extraordinary because we used to think that if you lived in Florida and you had access to the sun, you would have adequate levels of vitamin D. But what we find is that the dermatologists have scared people into thinking that they have cancer from the sun exposure. So people are using sunscreen and they're not getting access to the ultraviolet light that converts vitamin D in your skin. So kids are staying inside, college students are studying all day long, going out all night, and people aren't getting out in the sun. So the combination of those things, playing video games, all that stuff, we see vitamin D deficiency in a lot of people. My kids have it, I have it, my wife has it, but everybody that comes in with a fragility fracture, almost everybody, 90%.
So should people be taking a vitamin D supplement? Are we talking like vitamins?
Yes.
If so, is this the typical kind that can be bought in a pharmacy? And
yes.
what levels?
Well, the recommended dose is like 800 international units of vitamin D a day, and that's for postmenopausal female. However, if you're deficient, and there's reasons why you might not absorb it well, if you're deficient, you could be taking over-the-counter vitamin D, probably up to 2,000 units of D3 daily, and that's vitamin D3 is in the whole in the pharmacy section over the counter. There are some people that are so deficient that they reach the level of osteomalacia, which is something we used to never see. And if their level is that low, we'll actually give them an additional pill that's a prescription of D2, that's 50,000 units, and we'll give them that weekly and monthly oral, but it's all by mouth.
Well, what about calcium in milk, for example?
Sure. Calcium is important because once you've got the vitamin D that helps you absorb it across the stomach into the bloodstream, then you need to have the calcium. So if you don't have the calcium, the vitamin D doesn't do any good. 1,200 to 1,500 milligrams is usually advisable. There are some people that shouldn't be taking it a lot because they can get kidney stones, and there are some people that need more because their kidneys spill too much calcium and it doesn't stay in the bloodstream. So there are people that need to have adjusted doses and need to be followed medically, but usually it's 1,200 to 1,500 milligrams of calcium.
Well, let's switch gears a little bit and talk about treatment. Have there been changes recently in how these fractures and breaks are treated?
Well, I mean, for the fracture, it depends on the type of fracture, but usually we do something to stabilize it and give it a chance to heal. And once you do that, then it's a matter of strengthening the bones.
Okay. What kind of questions do you hear most from patients?
Well, number one is there something I could have done to change this? And most of the time it's genetics. Most of the time it's predisposed. And sometimes like the sunscreen and getting out in the sun and things like that. But once we ask people to be active, and we ask people just getting out, exercising, light exercise, maintaining your fitness, keeping your muscles strong, all of that helps. And so those are the things that we ask a patient to do to try and prevent and treat themselves.
That's great advice. Well, if some of our viewers wanted more information, how could they possibly reach you or someone?
Well, I work with Sacred Heart Orthopedics, as part of the Sacred Heart Medical Group, and you call our number at 494-9000, and we'll be happy to look at them.
Well, great. Thank you. That's great advice. We really appreciate it.
Thank you.
We'll be right back with more Coming of Age and Fitness After 50.